All right, ladies and gents, so today we're going to talk a little bit about why it's important to shoot somebody here center mass with multiple well-aimed shots in succession of one another. So here we have this diagram of the human body. Now we have the main organs, and we're going to talk a little bit about what each of these do and what's going to happen if somebody gets shot in one of them, or if you ever get shot in one of them, what you could do to best keep yourself or your loved ones safe when injured. So the first thing I want us to notice is the brain. Now, above the brain here, or in front of the brain, I should say, we have what's known as the T-box. So under the eyebrows, here are the eyes, and then the nose. Now, this makes the shape of a T or a triangle. The reason why this is so important is because when you put a well-aimed shot right here, this is all soft tissue and it goes directly into the brain, and then it hits the brain and immediately incapacitates the central nervous system. This is a surefire way to completely neutralize a threat with one single fire shot, and that's why it's important you train single fire shot to the face in order to neutralize a threat. Because when we start talking about body shots here in a moment, what you're going to realize is that people don't really go down with one or two shots. I mean, I've seen people get shot as many as like 20 times. I think 16 shots maybe was the most, maybe more, I don't know. But they were still alive. And so with the mixture of adrenaline, with the mixture of the fight or flight, fear-based sympathetic nervous response system in the human being, the resilience of the human body, the amount of time it takes for us to bleed out or to suffocate with tension pneumothorax, it takes time, it takes multiple shots. You're very, very rarely going to neutralize a threat with one single shot. Maybe if you hit them directly in the sternum, maybe if you hit them directly right here in the face, that T-box, that's like the only guaranteed way to stop somebody. So practice those single fire shots to the face from the concealed carry draw in less than 1.4 seconds at about 7 yards and out, and you're sitting really, really good. 7 yards for 1.4 seconds, and I would add probably 0.2 seconds for each yard that you go beyond that. Now, that's the T-box, that's the brain. If you hit somebody in the head, obviously it could still potentially penetrate the skull, it can knock them out, it can concuss them, it could kill them. But I have known quite a few instances where people have been shot in the head. I've worked with dudes who've been shot in the head. I've talked to people who've been shot in the head. Went to school with a kid who got shot in the face, and everybody, they're fine. Like, they got jacked up, but it didn't kill them. And so it's important that we're aiming for that T-box or that triangle right there, that triangle of death. Now, let's talk about center mass, like right here in the center of the human body, where you'll usually see plate carriers or armor for human beings. And that's because this is where a lot of really vital organs happen to rest. Now, if we get one shot off and it hits somebody, let's say right here, you got the heart located over here on this side. You got which actually is anatomically incorrect. This is kind of backwards because your heart rests over the left side. But I digress. You hit somebody right there and you puncture the lung. That's going to create some damage. However, you're not hitting any major blood vessels. Major blood vessels like arteries, you'll bleed out in 60 seconds or less. And then let's say you put another well-aimed shot and then you happen to hit them right here. Well, all you did right there was puncture the lung twice, the same lung twice. And what's going to happen is that as that person breathes in, that air is going to go into the lung. And now, instead of going into the actual lung, being processed, oxygenation and perfusion, and then push out carbon dioxide, it's going to go in between what's known as the pleural space. The pleural space is that elastic band, it's like this sticky fluid, where here's your lung, here's the wall of your chest cavity. So as you're breathing out, exhaling, breathing in, exhaling, it's basically stuck to the inside. It's like a surfactant. It's like stuck to the inside of the cavity of the chest. When you puncture that, what happens is it slowly starts to peel off like tape or glue, and then eventually it starts to collapse, and that lung's going to collapse in on itself. Now that empty chest cavity, where there was once a lung, is filling up with air, and that air is going to develop pressure, and that pressure is eventually going to push into the heart, and that's what's known as tension pneumothorax. And so getting a couple shots off center chest here, sure, it could do some damage, but that's going to take quite a while for that tension pneumothorax to actually kick in. So what do we do if we have a lung injury? Well, you're going to go for something like this, which is an occlusive dressing, and all you do is rip this bag open, and it's going to have a sticky side and a non-sticky side. And it comes with two. Why does it come with two? Because of exit wounds. And so you'll peel it off, sticky in there. It's kind of actually a good representation for what the lung looks like when it starts to collapse. And you're going to place it over that wounded part of the chest. What this is going to do is this is going to keep other debris from entering into that chest cavity, minimize infection, but it's also going to allow you to control the pressure that gets built up inside of that chest cavity. Once they start to feel pain or pressure, or you start to feel it, you can simply just pull this back and then push down and burp that wound, or you could use something called a decompression needle. I'm not going to really talk about decompression needles here today because it's somewhat of a more advanced technique, even though it's really, really simple to use, and I have seen it used in real life. It doesn't inflate the lung, but what it does do is it releases that pressure. Because remember, we're building up pressure, it's pushing on the heart, we need to release that pressure, which will allow us to increase life. I think I worked with a guy who gave himself like 3 or 4, maybe even more compressions within a firefight. So it definitely does work, it's very effective, but that's what we're gonna wanna do if we get some sort of a chest wound. Now, obviously, if we hit somebody here dead center, it's gonna hit the heart, they're gonna bleed out very, very quickly, and there's nothing that we can really do for that. And then also keep in mind that coming from the heart, there's a lot of major arteries. Specifically here we have this piece right here is called the descending aorta, and this is the ascending aorta. And then here we have brachial nerves. Keep this in mind that veins and arteries and nerves all run along bone. So wherever you have bone, right next to that is an artery, a vein, and a nerve. And this is the body's way of keeping those things safe. It has a nice solid bone right there. They're usually going to be on the inside. So like in here, not out there, because if you get attacked or bit or something from back in the day, you're going to be protecting those major arteries, those major nerves, those major veins, which you can bleed out if you do puncture a large vein. It just takes a little bit longer as opposed to an artery. And you know the difference between the two because artery is bright, foamy, arterial blood, which is very bright red. And venous blood is like a dark, like a maroon almost type of a red, and it oozes. Arterial is like where it's squirting on the heartbeat. Venous, it could squirt a little bit, but it's really just going to be oozing pretty consistently. So if we shoot somebody in the chest, obviously we have a great chance of hitting either the ascending aorta or the descending aorta, the heart itself, or any of these major organs over here. Hit them with the lung, hit them in the heart, hit them in one of these arteries, you're really jacking somebody up at that point. And of course, if we hit somebody in the spine, which is running directly down along with that descending aorta, then we're going to really be doing some damage as well. It's going to be paralyzing them from the point that it's hit and everything below, which could incapacitate or neutralize a threat. So hitting them center mass, very important. We want to work on those shots. We also want to get those triangles of death, those T-box shots in as well, because that's going to be very effective in stopping a threat. The goal isn't to kill somebody. The goal is to stop a threat. Don't think, oh, I'm going to kill this person. It's a waste of life. I'm telling you guys, I've stood over a lot of dead bodies. It's a waste of life. So let's talk a little bit more about what we could do if we get hit in one of these major arteries, like peripheral, like meaning like in our arms or something. So recently there was a Chicago shooting. Everybody's crying about it because they fired 91 shots at this guy after he shot a cop. You shot a cop, you deserve to die at that point. No human being has the right to take the life of another human being. No human being has the right to harm or hurt any other human. If you do that, then you deserve everything that's coming to you, plain and simple. So maybe just don't shoot cops. He got shot like in his wrist and his shit was jacked up. I mean, I don't even know if he'll be able to keep that hand. And he had difficulty putting a tourniquet on. So this is a tourniquet, and this is just such a great tool for these peripheral types of wounds. Because again, if we get shot and it hits the artery here, your radial artery, then you could bleed out in less than 60 seconds. The further away from the heart that you get hit, the longer amount of time that you have, because there's less pressure, but arterial bleed's an arterial bleed, and you need to get a tourniquet on, and you need to secure it, and you need to stop that bleed as soon as possible. What a tourniquet does is it compresses all your muscular tissue, that artery, that vein, all up against the bone so that it basically cuts off that hose. Like when you take a hose and you squeeze it and no more water comes out, that's exactly what a tourniquet is doing. So you could store these a bunch of different ways. I'm not going to dive into tourniquet storage here, not necessarily right now, other than the fact that I will say I don't double loop mine. You can see how these have 2 loops. I don't double loop mine. You could really get a lot of torque down with just one loop being run through. And what I will also say is that sometimes it is good to have them like this. I'll tell you, it's easier to store them where they're already looped and circular. So if you need to, you could just throw it over your incapacitated extremity. It's easier if you need to just to bite it and rip it out, like if it's going over a mangled leg or something really big. That's easier than trying to loop this with one hand or while you're wounded or injured or in a high stress situation where you lose dexterity. So I recommend having it looped with the 1 loop, and then I compress mine like such. And then depending on what I'm doing, like if this is in like a shoulder pocket or something, I'll have that little red tab just sticking out of my shoulder pocket or one of my pants pockets. It really just depends how I'm setting myself up or what I'm doing. But I like to have that showing just so people know, hey, that's where the tourniquet is located. So you pull this thing out, and then if you're putting it on somebody or if you yourself are wounded, let's just go over you yourself. Say my arm is shot. I'm going to get it up high on that extremity. Do you need to get it high up on the extremity? I don't know. There's different methods to doing this. I get it up as high as possible because I don't want to potentially miss an exit wound, like it hit my bone, came up here, popped out here. So I always want to get it up as high as possible on that extremity. Now notice the way that I'm cinching this down. I'm cinching it towards myself. This is the way we want to do it. Don't put this on where you're cinching it away from you. You want to cinch it towards yourself because this is going to allow you to get all that good pressure on there. And then you could even Velcro it down. And this is where you'll begin to turn what's called the windlass. So don't store it with that locked in there because you just saw that could be problematic. I would recommend that you just keep this pinned up that way, keep this free floating. And that way, once you have the pressure on, locked down, you can just begin to twist this, twist it until the bleeding stops, and then you can secure it back in there just as such with that little white tab or whatever type of tourniquet you have. There's many, many different types. So once you cinch that down, you're going to stop the bleeding. Then you can begin to either continue to fight or get yourself to more advanced medical treatment, whatever it is. But a tourniquet is going to be a great way for the legs and for the arms if you get hit in one of these peripheral arteries. And then down here in the legs, of course, you have the femoral arteries where it breaks off right here. Another really important spot. So that is arteries, that's the heart, that's the lungs. Let's talk a little bit about the pancreas. So your pancreas is going to be located basically right here underneath, kind of behind your stomach. And let's also talk about the stomach while we're at it. The stomach and the pancreas are what's known as hollow organs, which means if they get punctured, you're probably not going to bleed out because of that puncture wound, but you're also going to be spilling a lot of contents into other parts of your body. So for example, the pancreas helps regulate blood sugar, produces insulin and glucagon. It also has a little bit of bile in it. Your stomach has some bile in it. So if those get wounded, your stomach also has like food in it. That stuff's going to come pouring out within your abdominal cavity because all your organs are basically kept inside of this little pouch underneath your lungs, called the abdominal cavity. And so when that gets punctured, if this stuff starts leaking out, it's going to leak out into that packaging. And now you're dealing with things like long-term infection or septic shock, which is a really bad situation to be in, especially when you already have severe trauma. So if your pancreas gets shot, if your stomach gets shot, the best thing that we could really do at this point, sometimes I'll still throw an occlusive dressing on a wounded person if it's close enough to that chest cavity. So just to be clear here, the chest cavity is where your lungs are at, and then your abdominal cavity is where your abdomen begins. But if you get shot like somewhere near here, sometimes I'll still throw an occlusive dressing on that, especially if it's not pushing out a lot of blood. Because the only thing that you can really do at that point, if you do have a serious bleed, like if the liver, for example, gets hit, liver is located right here along your right side, your stomach, and then your liver. That's a solid organ, a lot of blood going through there. And so when that gets punctured, you're going to bleed out a lot. Same thing with your kidneys here. If those get hit, those are located at the back of your body, but bullets obviously go through things. And so if you get hit with that, you're going to be shooting out a lot of blood. You're going to need to pack that wound as best as you possibly can. The problem with packing wounds in the abdominal cavity is that it's just never-ending space. And in order to really stop a bleed while packing a wound, you have to get severe packing pressure onto that wound. And what I would recommend for that is something like combat gauze, where it's shellfish impregnated, which means it has clotting agents, but you have to be trained properly. Once you get that pressure in there, your thumb in there, you cannot relieve that pressure. You need to keep packing and packing, and so you're sticking both your thumbs inside of that wound, possibly making it bigger than what it originally was, but the goal here is to stop that bleed. Now, if you're packing it into the liver, it's going to be really, really difficult. And if you can get some sort of controlling on that bleed, or at least reducing it a little bit, what I would then recommend is either, like I said, throw that occlusive dressing over it to help maintain that pressure, or something like, these cinch bandages where, you're wrapping it around, and then you're just cinching it down really tight, not tight enough to restrict the breathing, because they obviously still need to breathe. We're really concerned about oxygenation and perfusion because they're losing blood, but we want something to hold that gauze in place, that combat gauze in place, so that we're hopefully coagulating and creating a clot and stopping that bleed. But again, abdominal wounds, very, very difficult. Packing is going to be more done for like extremity wounds, or even like a junctional wound. Like if you get somebody who gets injured like in the groin junction or like in the armpits, very difficult to stop the bleeding there. And so that could be very useful. Packing a wound could be very useful. If you need to pack a wound, always remember, arteries, veins, and nerves run along the bone. So pack towards the bone and towards the heart. So if I'm shot right here and I have a lot of blood coming out, you're not going to pack down in this direction. You're going to pack towards the bone and up, because that's where the source of blood is coming from, the heart, and we know that the artery is against the bone. It's going to be very difficult, especially if you've never done this before, to identify where the bleed is coming from, to feel it. Be very careful. Bone is very sharp, so if like a bone got fractured, bone is very, very sharp once it's broken. And so don't be doing this on some person who you're uncomfortable with mixing blood with either. If it's just some random person on the street, you're worried about like hepatitis or AIDS or some other type of disease, you got to make that call in that moment. It's not an easy thing to, watch another human being die. I don't think that I've ever just watched some person in the States die, but that was a risk that I always incurred. Always keep gloves with me, and I highly recommend that you do the same as well. So, long-term effects of getting shot in the stomach, digestive issues, secondary infections, same thing with the pancreas. You might have some sort of diabetes-related issue, blood sugar, glucose-related issues. And then in the liver, as long as it's not too bad of damaging, you should be fine, because the liver does regenerate itself pretty well. Now, let's talk about the gallbladder. The gallbladder rests right up above, kind of behind the stomach as well. So this is what we call the upper left quadrant. We break this into the abdomen into 4 quadrants. I'll use purple for this. So technically this is the upper left, upper right, lower left, lower right. So these upper quadrants are pretty shitty to get shot in, no doubt about that. If you get hit in the gallbladder, lots of bile is going to be coming out. It smells, it reeks. One of the most rancid smells I've ever had in my life was raw bile pouring out of a human being in their gut wound. It was this chick in Syria. And you're going to deal with probably secondary infections, things like that, maybe long-term digestive issues. Now let's talk about the intestines a little bit. So if you get hit in the intestines at all, what is in the intestines? Bile and shit. So probably one of the better areas to get shot at, being these lower right quadrant, lower left quadrant. There's not many major vital organs, like especially in the peripherals of those quadrants, but you're going to be dealing, you could bleed out with arterial bleeds, even though it's very small arteries, very small veins. The intestines are very vascular. And so this would be an opportunity to put in a little bit of combat gauze if you feel like you can. Again, packing them down on the wounds, I mean, it's just really hit or miss. It's just dependent upon the situation. If they get eviscerated, like the gut, and their guts come pouring out, then what you're going to want to do is have something like just really the bag of this occlusive dressing. Put the guts in as nicely as you can, and then have this bag along with this cinch dressing, and you're going to loosely wrap it around. My guts are hanging out, kind of put them back in. You could really lift the skin flap and kind of like jiggle it in. And then I'm going to put this non-adhesive, like you don't want something that the tissue is going to like dry into and then you're pulling that off. So you want something that's like smooth, like this plastic wrap. Put it on there and take this dressing, cinch it on there, some ace bandage or something. And now their guts are basically just sitting behind this makeshift stomach lining that you've created. If you have one of these with you, a stapler, this could be a really great opportunity to try to like staple them in a little bit. Don't get too crazy about it. Obviously, we want to get them to a hospital more than anything, but do not use something like combat gauze. I really don't even recommend using any type of gauze. Don't even use like a pressure dressing directly. If you do and you water it down cool, that moisture will keep it from sticking into the intestine, but you don't have very long. And so my recommendation would just be use like even use like a plastic bag, like even something like this, and then ace bandage it around. That's probably going to be better than using any type of gauze. So long-term infection, possibly bleeding out, possibly losing some intestine, but lower quadrants are definitely not the worst place to get shot unless you get shot center. And then of course you got the spine and you have that descending aorta to really worry about. Lastly, let's talk about the bladder. If you get shot in the bladder, yeah, that'll suck. You'll probably have some long-term, issues, but really probably not anything too bad. The worst part about being shot in the bladder is it's center mass. And so center mass means what? Again, descending aorta, spinal injury. So we don't really want to get shot anywhere, but the bladder would have those types of potential consequences as those second and third, meaning that it's the spine or the descending aorta. And again, if you get shot in the descending aorta here, like center line or in the neck, there's really not much that you could do except, well, down here in the center, you're just going to be fucked. If you get shot in the neck somewhere, like in the side, you'll have to apply pressure to that. You can't put a tourniquet on it. You can't pack that. So you're going to have to put some sort of like pressure on it, direct pressure, very precise pressure, in order to potentially slow that bleed down and get that person where they need to go. So that's a little bit of information there for you guys on the effects of shooting somebody in those places, or if you or somebody you know gets shot, like kind of what you could basically do, basic old trauma. Remember the March algorithm, massive hemorrhaging, airway, respiration, circulation, hypothermia. We didn't really break that down. I just wanted to go more specific into like the different types of organs and what that's going to really do to the human body and the condition. However, always prioritize those massive bleeds first and foremost. Then we want to make sure that they have an open airway of some kind. So if they got shot in the jaw, if they're unconscious or something like that, we need to know how to bypass that, either with a oropharyngeal or a nasopharyngeal or a crike, where we're going in through the neck. You shouldn't be doing that unless you're actually like trained in it very extensively. But this is just a little bit of information, basic medical care, medical trauma that hopefully you never have to use, but if you have any questions on it, let's talk about it. We're going to be running some classes here. We got the classroom getting set up right now. It's pretty exciting. And as always, join the Lethality University if you're looking for ways to help people and help America and help your community. Just join a group of like-minded people who are here to help sharpen one another's skills so that we can become a self-sufficient and truly free nation once again. All right, everybody. My name is Joe Malone. I'm a former MARSOC Marine, and it's my mission in life to teach people how to protect, preserve life, and help one another.